just as in the ENT ophthalmoscopic examination, the scope of the ophthalmoscopic examination in the primary healthcare centers is we are more interested in diabetic retinopathies. Okay, some common maybe some common other eye problems, but apart from that, we are all interested in doing the otoscopy for the ophthalmoscopy for the eye examinations. Okay. So here we are going to learn how to perform ophthalmoscopic examination and diabetic retinopathies, what are the diseases that are there, and some pediatric examination for the red reflex. These are the three objectives in the primary healthcare when you are performing an ophthalmoscopic examination. So before how to perform ophthalmoscopic examinations, or before starting with the ophthalmoscopic examination, you need to first calibrate the instrument. How? According to your refractive error if present. So you need to roll the die and calibrate it accordingly, according to your refractive error. And you also need to perform or demonstrate the presence of red reflex, whether whether is a patient of adult in origin or a child. Then you first inspect the anterior segment. So ask the patient to look far and inspect from the arm length, then to the closer one. So this is how you are going to demonstrate that you are inspecting the anterior segment. So you ask the patient to look forward, and then from the arm length, you will start looking in the eyes and then coming back, coming closer, 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 closer to the eyes. And then back of the eye. How are you going to start? So when you come very close to the eye, then you just pick up a blood vessel. You see here, you see when you close to the eye, you see that there is a retina, the redness is there, and there are blood vessels moving around. So you start, you pick up a blood vessel and you start following it up. It will take you to the optic disc. So when you go into the while you're following a blood vessel, you need to follow 2-3 things. So number one is that are there any new vascularizations, and are there any ruptures, are there any blood spots there or not? And then you follow this vessel and then you reach to the optic disc, then you see the optic disc, and then you assess the macula. So how you demonstrate that now you are assessing the macula? You ask the patient to look into your eyes. So this is how you're going to assess the patient for the macula. Okay, now you see here, this is the normal retina. In the normal retina, you see that there are no spots there. There are no bleeding spots there. There is a blind spot present. The vessels, if you see, the vessel contours are okay. There is no ruptures and all that. So, and the second stage, we have neovascularizations. Okay, you see here that there are disruptions in the blood vessels and there are cotton wool spots. So this is all abnormality in the so some kind of retinopathy is going on. In the second case, there are fibrovascular membranes have formed. In the third, there we have massive hemorrhages. In the third, we also have massive hemorrhages. In the fourth, we also have neovascularizations. So what here important is you are not required to actually differentiate between whether is it non-proliferative or a proliferative diabetic retinopathy, but what we expect here is that you see that there is diabetic retinopathy going on, and you need to maybe refer this patient for further evaluation by an ophthalmologist. Here you see that's a normal tympanic membrane, a normal retina, and then there is proliferative and non-proliferative. This is the background ones. This is the proliferative one, and then you have neovascularizations, which is also a proliferative diabetic retinopathy. So this is that's the whole scope of performing an ophthalmoscopic examination. Now, what we are going to see is watch a video to see how we do the ophthalmoscopic examination.